Hello, everybody. This is part 2 of dog massage, specific to the hip joint, and in this case, even more specifically related to working with the hip joint with a dog that is having some developing hip arthritis. So, as said in the other videos, assessment has already been done. Positive response and related to just some mild therapeutic intervention was seen. So we're going to continue this, and my goal is to try to document it. So this is the hip in question, the right one. Now, like anything, it behooves us to do therapy on both sides, especially when you are assessing things. Assess the area of the body that you can compare and contrast to, so meaning the opposite limb and structure that is the closest to normal. Feel and assess and massage, move, everything. Even drawing with humans, you can get their verbal responses in the moment to be able to get some more information. But regardless, palpation-wise and based on certain vigilance of movement, how easy is it to do? How comfortable does it seem? Like anything, if you don't have an awareness of what joint end feel is, learn about that. A soft joint end feel versus a hard joint end feel. And so, best initial tactic for assessment: assess the unaffected side, then compare and contrast to the affected side, and anything you find there from a massage and manual therapy standpoint, not talking about strengthening anything, what we are going to be releasing. We are looking for things that are too strong, too tight. What is stuck in a concentric contraction? If we can lengthen those structures, this then allows the antagonist groups to fire more effectively. So I want things that are stuck in a concentric contraction to learn how to become eccentric. And then the antagonistic muscles that are being pulled too long are going to hopefully be able to fire and pull more effectively, and we balance out the tone of the muscles around a joint so that the movement of said joint is as energy efficient and comfortable, and we're going to a subjective level of measurement, as possible. So from a massage standpoint, if we just equalize the tone of things, that's a really good general place to start. If areas feel like they're too tight, go after that and spend a little bit more time on the stuff that's too tight versus the stuff that doesn't. That's just a natural thing that we do. It's a natural thing that all creatures seem to respond to. Inhibitory pressure on structures that are too tight has an immediate response of something correct happening. Now, when working with an animal, and I've already talked about safety first. If it's not your animal, be careful. Understand what stress signals and behaviors are: yawning, licking of the lips, blah, blah, blah. But when you're first introducing inhibitory pressure into tight muscles on an animal that can't talk to you, at least using our language, you gotta think from the perspective, and I actually frankly think about this with dealing with humans too. We have to help take the scary out of the pain. Meaning we have to be able to, through massage, specifically in this case it's inhibitory pressure plus some movement, I need to convince the structure, I need to convince the creature that what we're doing is not harmful. Instinctually, the very first thing anything has to do when an exterior stimulus is being put upon it is respond in the assumption that it's potentially harmful. That's a really good survival strategy, right? If we didn't do that, we would be just a cold breeze would knock us out, right? So, best practice is to do a little bit, and then let the dog, any animal, but in this case, let the dog get up and walk around. And if they come back to you, seemingly seeking more, then we both have made the agreement, hey, this is a good thing. You're maybe not liking the initial pressure and discomfort. There may be reactions that look a little bit like, they turn and look at you and obviously displaying that it's uncomfortable. But you can build up an awareness for them that we do this, and then it feels better. They pick up that it's a good thing then, but don't try to just throw the whole kitchen sink at an animal, especially if it's their very first introduction to some kind of therapy like this. So a little bit, let them get up and play and do a thing, and then come back to you, and then a little bit more. And once they're conditioned to the process, I've had dogs that I've worked with either just in general or have had more complicated issues, something as severe as an ACL reconstruction, joint replacement, etc., where had to be very cautious because the sensitivity to an area that is injured or dealing with some kind of underlying chronic issue, they are going to respond much more with a level of vigilance and potential fear initially, as opposed to a younger animal that is everything's fine. So comparing a puppy's response to massage to an older animal, there's a different psychological piece there, and you just have to be aware of, just like a person, never had been massaged, in pain, we need to kind of meet them at their level, and less is more. I hope that's enough said. So, first part here is gonna just be looking at doing some general movement of the joint. We're not gonna do any inhibitory pressure with this part. Just let's get that knee and hip moving in every plane of movement. Specifically in the movements that it does not seem to do enough of. What is it doing? It is in flexion and adduction, and that's it right now. As far as the rotational piece is concerned, when I was looking at her walking, the tendency actually seemed to go a little bit into internal rotation. However, it's a little bit more common for them to get strong and dominant in external rotation. So, the rotational piece with this is not going to be, we may not get into that as much. I'm going to focus much more on sagittal and frontal plane based concepts here. One, because the movements are more profound and easy to show in a video like this. The muscles are bigger and easier to palpate. It's easier. The rotational aspect, take all these concepts, you'll see me doing some of that, but take all those concepts and try to apply it. But just like with working with any animal, including a human, the deep rotators of a joint are deeper and harder to get to. They're smaller, and because of them being deeper and smaller, they're more sensitive. You should really know what you're doing if you're going to be trying to get to the rotators. Much safer and easier to work on flexors, extensors, abductors, adductors. With all of us, the tendency is going to be too short in the flexors and adductors, and too long in the extensors and abductors. So, next part. And forgive me, my hair is out of control. Need a haircut. So, we're gonna get her nice and comfortable with her. Have to be a little bit, like, get her laid out on her side. Good girl. So, A little bit of a lip licking. See that? You know, that usually means, you know, kind of nervous, trying to appease, you know. So if I see that I just try to put her at ease, you know, lip licking, try to say a nice thing, with a cool girl, a little bit of a tummy scratch. Just get her settled, let her know everything's okay. Now, she's already conditioned to some of this manual work, okay? And I wanted to test this stuff out before I, you know, put myself on the spotlight. So, now, here we go. We got ourselves our hip joint. So hip joint up here. We can palpate the greater trochanter, all that good stuff. Our knee joint here, little patella, all that. Right here, that's the actual ankle joint. The hock, it gets called in canids. That's the ankle joint. These then are the tarsal bones. And then the toes, just like ours, those are just the little phalanges. So, ankle, knee, hip, okay? Now, she's already responding so much easier. I do wish in some ways I had got some video of how it was when it was seemingly more acute yesterday. When I tried to take this hip into extension, she would naturally guard up and push back against me. So I would I just get my hand just superior the knee, up on the quads, and just slowly push until I got that resistance. And then I just hung out there. I let her push against me as much as she needed to. I didn't let her gain any more movement and deflection, but she pushed as much as she needed to, and slowly but surely let that lengthening occur. Once I can get what feels like the knee into full extension, then I'm pretty happy. We will challenge this further, but if I'm looking in, if I'm using the spine as a guide here, I want to be able to get the femur perpendicular to the spine. I want a nice 90-degree angle here. I want to at least be able to get that. Just like with humans, you should be able to get from 0 to 90 degrees at the hip and the knee in order to perform any basic functions of daily life. So think a chair or getting in and out of a car. You need to be able to get your hips flexed, your knees flexed to at least 90 degrees and a little more, preferably within the range of 100 to 125 is much more preferable. So 90, and a little, and just hold. And sure enough, if we look, and I just pay attention to how she's doing, watch their breathing, you know, she's doing an exceptionally good job. Again, a little condition, I just felt a little resistance, just holding that, and I just keep following it, not forcing it. I am not a fan of aggressive static stretching. This is not going to go into a phase where we take the joint to end range. This is what I am entirely only thinking of as lengthening. I want to take the joint to an appropriate level of going through a full range of motion, but I'm not going to go to end range and then through any kind of barrier. So with her, I'm going to be very happy at 45 degrees of extension. When I was assessing this, I actually did not find a hard end feel of the hip joint, which made me very happy. I was worried initially. So, now you see how I'm supporting this, by the way. I'm holding above the knee and then pretty much right at the ankle joint. And I just keep on letting it come back. What's interesting is that she really seems to go into a state of ease in response to this. Um, when I first was doing some assessment, what I was doing is I was actually taking the leg back into this position in order to palpate the adductor, adductor group, specifically like gracilis, etc. And when I got my hand on gracilis and had the hip in this position, she just fully let her head down, closed her eyes, and her breath became much deeper, at ease, closer to something like sleep. She just seemed more relaxed, right? So use your intuition, pay attention. This can be a good lesson for what we do with people. Sometimes I don't feel muscles release, but I'll notice that people change their breathing. Take a deep sigh. That can mean an awful lot to see the breathing change to something that is more reflective of belly breathing, deep breathing, parasympathetic related kind of stuff. So now this just holding the joint in a position that it just doesn't go to. She used to stretch herself more, get these hind legs behind her, and really, almost trying to think of what's the opposite of downward dog movement in yoga, the cat cow, or it's not quite that, but where the legs are fully behind you and you're almost in a push-up phase and getting your chest up. She's stretching her hip flexors. And that's what it was. She doesn't do that as much anymore. I think because, she feels stiff. It's just not as easy. So like all of us, we tend to stop doing what isn't comfortable, which, I get it, but we're wrong. So just holding into extension. Next piece to this, taking it a little bit out. Now be a little bit careful here, but a little bit away from the body. So I use my body to help me. I'm going to get my leg underneath her knee joint to help support. My hand is now making contact with the medial thigh at the adductor group. I'm going to have this hand up more on the hip flexors, and I'm just going to keep the leg a bit into extension, but I'm going to think a little bit more about taking it into abduction. I want to take it away from midline, and I'll just open up that space in there. Oh, there's a good stretch. Other leg doing a stretch. What a good girl. And right there, I don't know if we actually saw it, but a big, nice, deep breath. That's a wonderful indicator with dogs, but really all creatures. Nice deep breath mean a good thing. So just holding. They have a level of resistance. I meet that resistance, but I don't let them push me back. So in this case, I took her into abduction, felt some resistance, I felt the muscles contract and push back against me, but I didn't allow that to take me further into adduction. Here's a contraction, and then it naturally lets go. So if we're thinking more profoundly, from a muscle energy standpoint, there's a lot of really cool natural contract, relax happening here. Just contract, relax. She's just innately doing it. And I find it really cool in how maybe, from just a much more below the nose state, how these kinds of reflexes work so well for us in our manual therapy. There's a contract, and then there's the relax. And sure enough, I keep on just getting a tiny touch of more range. Just a little bit. Every time there's a relax, that sense of a barrier and bind is less. And I get just a little bit more. Whoa, there was a bigger one. I don't know if that was a sleep twitch. Oh, it's doing so good. Now with this, my sense of degrees is a bit limited. I would say I'm maybe thinking 15 degrees of abduction. Really, if I'm just measuring from the rib cage, I want, at least a full limb's width. So call it a couple inches here. But if I'm approximating my degrees, 10 to 15 into abduction. Just holding. I'm going to get my knee out of the way just so you can see. Just holding. So, holding in extension, holding in abduction. How profound. Just that can go a long way. If I was going to couple this into something I did before activity and then post activity, this would be the before activity part. Do it all the time. The before activity part of this, of just taking the joint into extension and abduction, important all the time. That's the thing that you can't do too much of. So, before activity, then go do an exercise and play, go for a nice walk, all that stuff, come back, then we'll do the actual manual therapy piece. If there isn't going to be exercise, then we go right into the manual therapy, massage piece, as I'm going to do in the next video. Next part is actually going to be doing some targeted inhibitory pressure of specific muscles, incorporating some joint movement. It's going to look just like anything that we do. So inhibitory pressure plus movement is the biggest intervention we typically do, whether it be passive movement or active movement. Inhibitory pressure plus movement, challenging the tone of muscles to get more balance and equalized. But this whole principle of thinking about where is the joint put too much. And for humans, I think we're sitting around too much. Dogs laying around all the time. It seems like a very blissful experience, but just look at how they tend to position themselves. Assume that whole position is where things are tight, and take them out of that. Hold them there, and put a nice prayer and positive energy into it. All right, on to the next one. I will see you there.